Hi friends, welcome to classes by Lab Doctor. In today's class, let us understand the functions of calcium in the body. So calcium has various functions in the body, including the maintaining of the strength of the bones and teeth. It might be blood clotting. It helps in the nerve conduction. It helps in the contraction and relaxation of the muscles, helps in the release of hormones and other chemicals. It helps to maintain the normal heartbeat. It supports a healthy pregnancy. It helps to reduce the blood pressure, and also it prevents and treats osteoporosis. So let us begin with the nervous system. So what is the function of the calcium in the nerves? So calcium is an essential element. It's an essential mineral which plays a very important role in the function of the nerves. So what does it do? It helps in the release of the neurotransmitter. So calcium acts as a trigger. So it helps in the release of this neurotransmitter from the synaptic terminals to the synapses. So whenever these neurotransmitters are released, a message is conveyed. So electrical signals are passed. All this will help in what? In memory, in learning. So whenever there is any deficiencies of calcium, whenever there is severe hypocalcemia, it affects the brain functions also. Patients suffer from depression, patients suffer from anxiety. All this can happen. They have issues with their memories. All this can happen in less of calcium, because calcium is required for all these functions. So you will see that this is a synapse, and you can see here the calcium has come inside, and these are the pockets, synaptic vesicles, wherein the you can see once this calcium triggers it, so you will see that there is a release of these neurotransmitters. So these neurotransmitters go down this synaptic cleft, and they will do their function. So they are important in memory formation, metabolism, cell growth. All of this will depend upon these neurotransmitters and calcium. So I've told you, once this calcium enters here, it will help in the release of this neurotransmitter from the synaptic vesicle. So it comes into the synaptic cleft. So like here you can see the acetylcholine which is released, and once they enter from here, they can also go into the muscle contraction. We can also stimulate the muscle. So neuromuscular junction, suppose if there is a muscle here, they will also stimulate the muscles. So the muscle function, the muscle contraction and muscle relaxation also depends upon this calcium. So this calcium, which is when it is released into the sarcoplasm, they will activate the myosin and help in the binding of troponin, which will help in the contraction. So it also is required for the repair of the cells, the muscle cells. It helps in the energy storing of these muscle cells, and also to give strong and healthy muscles we require calcium. From the sarcoplasmic reticulum, the calcium is released. So this calcium, whenever it comes, this helps in the muscle contraction, cardiac development. It helps in the conductive system. It also helps in these housekeeping functions. So now the same thing happens in your cardiac muscles also, because calcium is very important for the functioning of the heart. So in the heart, you know that there are two pumps. One is the sodium potassium pump, the primary pump, and this is the secondary sodium calcium pump, that is the secondary pump. In this pump, what happens? The sodium goes outside and potassium comes inside. So the potassium is distributed more inside and sodium is more outside. So in this secondary pump, what happens? The sodium comes in and the calcium goes out. So this secondary pump is dependent on this primary pump. In the heart, you will see that the cardiac plateau or the phase 2 which happens is the longest phase of cardiac action potential, and this is very important because it is during this time your heart fills. So this balance between the inward movement of calcium and the outward movement of potassium will maintain this cardiac plateau, and this plateau phase is a part of the effective refractory period during which the muscle contraction will be initiated. So the influx of calcium stimulates the release of calcium from the sarcoplasmic reticulum. I have already told you. So once the calcium enters, that will stimulate the sarcoplasmic reticulum to release more of a calcium. Calcium has moved inside and the potassium is moving out, maintaining the plateau. So this calcium ions, what happens, they regulate the contraction by binding to the troponin. So once the calcium comes here, this calcium will bind to troponin C, and when there is binding of this troponin C, what happens is the myosin heads are now open, so the myosin heads can now bind here. So that is how it makes this conformational changes and helps in the muscle contraction as well as relaxation. Similarly, calcium also helps in coagulation. How it does help in coagulation? Because calcium activates these factors, and also it helps in the conversion of prothrombin to thrombin. So you will see that whenever we give EDTA, that inhibits the calcium and it inhibits the clot formation. So the formation of the clot, the stabilization of the clot, all depends upon this calcium. So calcium plays a very important role in this coagulation. So whenever there is hypocalcemia, patient may present with these purpuric spots, etc., because there is problem with coagulation, and EDTA inhibits this calcium and hence coagulation is prevented. So here you can see how it will stabilize the clot formation. So it helps in the conversion of prothrombin to thrombin. I have also told you that it is important in maintaining the bone and teeth health, especially the calcium phosphate. Whatever is there in the bone and teeth, it is in the form of calcium phosphate. It will strengthen and harden the bones. So low level of this calcium in the bones and teeth can weaken them. It can cause the bones to be brittle and more likely to break or fractured. Similarly, it gives teeth its structure and its hardness, and not getting enough of calcium will cause this loosened teeth and tooth loss also. So you have to have enough calcium in your diet to maintain your strong teeth as well as bones. Pregnancy, to maintain a healthy pregnancy, calcium is a very essential nutrient, and the WHO recommends that the pregnant women with low calcium, they should take minimum 1.5 to 2 grams of calcium per day to reduce the risk of preeclampsia. So brain, I have told you that calcium is a very important element in the brain's normal functioning, and it plays a very important role in the many functions of the brain, like brain cell communication, memory formation, blood flow, cell survival, neuronal integrity. All this will depend upon the calcium. So whenever there is less of calcium, all these factors, all these functions will be affected, which can impair the cognition, which can impair the memory, which can form mood swings, which can cause depression in patients, because calcium is very essential in brain cells to communicate with the axons, or to communicate with the to release of the neurotransmitters, to pass on the message to the next neuron. All this will depend upon the calcium levels in the brain. Calcium also helps to regulate enzyme activity. So there are certain enzymes which are activated by calcium, like glycogen phosphorylase kinase, amylase, etc. are activated by calcium. Pyruvate kinase, trypsin, these are inhibited by calcium. So enzymes are also regulated by these calcium levels. So calcium has important functions in our body. It could be formation of bone and teeth. So whenever there is deficiency of calcium, we will see changes in the bones. We will see osteoporosis. We will see loose teeth. We will see tooth decay. There is enamel which is weakened, which is bleeding, etc. Nerve conduction. So whenever there is deficiency of calcium, we will see there you patients will have tingling, numbness. We get various signs like Trousseau signs, Chvostek signs, etc. All because calcium plays important role to help in the excitability of the nerves. Calcium plays a very important role. Muscle contraction. So whenever there is deficiency of calcium, there you can see that patients will have lot of aches, lot of pains, etc. All this because calcium maintains the integrity of the muscles. Activations of the enzymes, blood coagulation, secretions of the hormone. It acts as a second messenger and also acts on the myocardium. So whenever we select certain drugs like digitalis, etc., that inhibits this calcium. So calcium, whenever there is deficiency, their patient can have lot of heart problems, arrhythmias, etc. All this happens because they help in the activity, in maintaining the action potential, in maintaining the plateau of the heart. So calcium is a very important mineral in our body. So in the next classes we will see what are the causes of low calcium levels in our body. So that is all about the functions of calcium. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.